Professor Salim Abdool Karim is an epidemiologist, infectious disease specialist, and the chairperson of the board of several advisors to the Health Minister, Dr. Zweli Mkhize. He gave a wide-ranging presentation on Monday night, which highlights the country's COVID-19 trajectory and what to expect next. In April, before the easing of lockdown level 5, he explained how the phased easing of the lockdown would happen and what it meant for the spread of the virus. Professor Karim joins us now to take us through what the current trajectory means and what we need to do next. Professor, thank you very much for your time with me on flattening the curve. Are we still looking for a peak in infections come September?
So when we look at the way in which the epidemic has grown over the last few weeks, we had expected that as we ease restrictions, and especially the very substantial easing that occurred on the 1st of June, we expected that somewhere between the 7th and the 14th of June, we would start seeing an increase in cases. And indeed, that's what has occurred. So somewhere around the 9th, 10th, 11th, in the various provinces, the number of cases have started to increase quite substantially. That reflects the movement of people and reflects the way in which the virus is spreading. How it proceeds from now is highly dependent on our behaviors and the extent to which we adopt the protection measures that are available, or the mitigation measures like hand washing and so on. And the rate at which it's going at now, we can expect that we will see quite a rapid increase, driven principally by our most populous and most dense province, Gauteng, and that the peak will occur probably, and I'm not a predictor of that, but I would suspect, based on the current trends, somewhere in July, August, probably more like August, September.
Let's be quite frank though, Professor, even if we do see this peak in the next 2 months, the coronavirus pandemic is going to be with us here in South Africa for quite some time after that.
Yeah, I think it's a point that I've been making, that we originally, when we started off looking at this problem in March, we were looking at it as a sprint. We were saying, what are the immediate measures? What are the urgent things that need to get done? Now that, we are in week 14 or 15, we've had, and we now have much more knowledge, and we've seen what is happening in many of the other countries. We have a better understanding that actually we're going to have to live with this disease and this viral threat for quite a while, for many months, if not years. So we have to find a way to balance protecting ourselves from trying to get on with our lives. And so that challenge is what we are in the midst of in this country. And it's most clearly demonstrated by the fact that we are easing lockdown, we are easing the lockdown and easing the restrictions while the cases are going up. Normally, if the cases are going up, you should be implementing more of your control measures. But we're doing it in the opposite way. And the reason for that is very simple, that the restrictions are not sustainable. They're not sustainable. The cost gets too high as you go longer. And so we have to ease the restrictions. But we have to ease it in a way that doesn't reintroduce high risk. It will introduce some risk, but the extent to which we can mitigate that is what's critical at this point.
You were in the unenviable position as the head of the advisory board that's advising government to go into lockdown. South Africa went into lockdown without a single death from COVID-19. With the benefit of hindsight, do you think that that was the right decision now that we're reaching a peak of infections and we're exiting lockdown?
Well, as we look back now, and we have the benefit of hindsight, as you pointed out, it's very clear that our decision at that point and our advice at that point as scientists to the government, and the government's actions were clearly, very impactful. And that's, if those steps had not been taken, if the state of disaster had not been declared, and the schools closed, and the gatherings prohibited, and the international travel banned, and then the lockdown instituted, we would have been in the situation we are today. We would have likely been in this situation sometime in April. And to be in this situation in April, when we haven't prepared, would have been, really a massive challenge for us. The health system would be already struggling, because think about it, we were doing barely 200-300 tests a day in March. And, today we're doing over 30,000 tests per day. And that's just tests. I mean, talk about the field hospitals, the number of additional ventilators. So the level of preparation that has been afforded to us by the time we have gained has been critical. And it'll make a huge difference in the way in which this epidemic plays itself out. Just one more thing, trying to get people to introduce prevention measures in March and April would have been a real challenge. Now we've had an opportunity. People have begun to understand this epidemic, see it, they can see the benefits. And so we're in a much better position today. Not least, we also have the benefit of new drugs like dexamethasone that has been shown to reduce mortality. So there are many benefits that we have accrued by taking early action, which then flatten the curve initially. But flattening the curve is not a single event. It's something we have to continue to do for a long time. But that bought us the time in order to do all these things. It did come at a cost. And, ultimately, people will have to work out whether that cost was worth the benefit. And, time will tell.
Professor Karim, would you say that you're satisfied with South Africa's preparations during the lockdown? We went into hard lockdown for several weeks. Do you think that we could have prepared better? Are we now ready to meet the challenge of the infections rising?
So, I have high expectations. So it was always going to be a challenge to prepare, I would call it prepare enough. I think, pretty much no country can really prepare enough. For starters, we actually don't even know what the peak is going to look like and how many patients we're going to need. Modelers can tell us X and Y, but we actually don't really know. But we planned based on the best available evidence we had. And I think where we've got to is probably an acceptable point. I would like us to have done more, but actually, I think where we have attained this point, just in terms of additional beds and so on, I think has been nothing short of what I would regard as an amazing accomplishment. I mean, if you had told me, in February, don't worry, we can convert the whole of the Cape Town ICC into an 800-bed hospital in a matter of 6 to 8 weeks, I would have laughed at you. I said, we can't do anything in this country in 6 to 8 weeks, of that kind of magnitude. It would take us months. And they did it. They did it. It's there. It's, now we have additional challenges. Now we've got to find the staff. And of course, one of our big problems that we really having to grapple with is that in our hospitals, our healthcare workers are at such high risk. And it has to be expected because that's where the patients are. And because they're getting exposed and because they're getting infected, we have large numbers of our staff actually in isolation or in quarantine. And so hospitals are under increasing pressure because they have less than the number of staff that they need to start with. So this problem compounds itself in many ways. How could we prepare more for that? I mean, just in the short space of time we had, it's not really possible to train, 10,000 new nurses. But what we have been able to do is look at ancillary healthcare workers and draw them into this program to the extent, like community healthcare workers as one example of that. So I think, to answer your question in summary, I think we have done as good a job as was possible. And I am personally pleased with the progress that has been made. As I said, we can probably never prepare enough for what's going to happen.
Professor, we spoke about the fact that South Africa's infection rate is only going to peak now. The fact that we haven't been hit by this disease as hard as places like Spain, Italy, and indeed the USA now, do you think that that's affected the general populace's response to COVID-19? We've seen the taxi industry, for instance, now really just disregarding government's call not to fully capacitate taxi drivers in the vehicles that they're driving. And we're also seeing people ignoring government's plea to keep social distancing. You go to places of commerce nowadays, the malls are full, people are going to people's houses for braais. Do you think that that's played a role?
You know, it deeply concerns me that we are seeing this kind of defiance, especially at a time when we all need to pull together. But I don't see this defiance as logical. I mean, when I look at when the taxi industry says we are going to go to 100% and we are not going to care about the risk of this virus, exactly who are they punishing? Are they punishing the government? Are they punishing their customers? No. When you think about it, who's at highest risk from this kind of overcrowding in the taxi? Well, it's the person who spends the most time in the taxi, the driver. The driver now is your highest risk individual sitting in a taxi that's overcrowded. So I'm trying to understand, why would they want to put themselves at risk? Because it means that now they won't be able to work. They'll have to go into isolation for 14 days. And what if they get sick and need hospitalization? I mean, this seems a very silly thing to do. And as an act of defiance, it seems like it's a self-punishment act of defiance. So I'm at a loss to understand what the logic is behind what the taxi industry is trying to do. But what does concern me is that we often, and I've seen this in the HIV epidemic, I've seen this in the New York coronavirus epidemic, that people don't take up prevention measures partially because they don't think it's going to affect them. This is a disease they think is going to affect others. And because they don't think it affects them, they don't see the need and they're not motivated to take up prevention measures. I have seen how that changes. I've seen how it changes dramatically. That as the number of cases go up, as the number of deaths go up, you will find large numbers of people, suddenly they have a family member, they have a friend, they have a neighbor, they have somebody they know who has got this disease or who has died of this disease or has been hospitalized for this disease. And now it becomes personal. Now it becomes something that they begin to question. If that person got it, I can get it. And that becomes a motivation to change their behavior. Now, we saw that in HIV. As people started dying in their large numbers, people changed their behavior. It happened in New York with the coronavirus. People started wearing masks, and they started social distancing, and they began to become the enforcers of that. So when they go to a shop, they go to a grocery store, and they get there and they see that the shop is not following the protocols, that they're not social distancing and that it's overcrowded and so on, they become the enforcers. They will say, no, I am not going into that store. That store is going to put me at risk. Because every time each person is saying, I'm willing to gamble with my own risk. They're actually saying, I'm actually gambling not just with my risk. I'm gambling with my family's risk. I'm gambling with my elderly parents' risks. I'm gambling with my co-workers' risk. I'm gambling with the risk of all of those I travel with to work every day. That's what they're doing. They're putting the whole community at risk. And so in a country like ours, where we are fundamentally, adherents and supporters and believers in the spirit of Ubuntu, where we believe in that who we are is because, as an individual, it's because of the collective. I believe that philosophy gives us an edge. It gives us an edge in that we will begin to see in a much more substantial way. We're already seeing it to some effect. I think we'll see it in a much more substantial way that people will be willing to take up prevention. Call me an optimist. Call me, kind of a person that wants to see good in things. But that's what I am hopeful, because I have seen that happen before. If it doesn't happen, we are going to see a higher peak. We're going to see a longer epidemic. And we are just going to have many, many more infections.
Professor Karim, as we finish our conversation, there's a very promising development in terms of a vaccine being tested here on the African continent, being led by Dr. Shabir Mahdi. What is your take on the vaccine trials? Also, a very, very long-term intervention, not a quick fix by any stretch of the imagination.
Yes, I mean, a vaccine is critical, until we have a cure or a vaccine for this disease. We will continually have to live with this threat. And a vaccine is particularly important because we have seen how we have eliminated the threat from other viruses through a vaccine. And so we can live much more confidently in an environment with other viruses because we have vaccines against them. There are well over 130 different candidates that are being developed. Now, the world has never developed a vaccine quickly before. It takes 5, 10, 20 years. I've been working on HIV vaccines for 32 years, and we don't have an HIV vaccine. That's one example. So we can't live in the, totally in the hope that there will be a vaccine. We can hope that there will be, but we also have to have an alternative if there's no vaccine, which is not an easy option to contemplate. Having said that, when I look at this particular virus, the thing that gives me some confidence that a vaccine is potentially a viable option is because of the genetic stability of the virus, and in particular, the genetic stability of the spike protein. It means that if we make a vaccine, it's likely to work against the current strains. And so for that reason, I'm optimistic. And I'm optimistic about the vaccine that's being tested. There are many other vaccines that are really excellent in terms of what we see in the animal studies. And ultimately, the proof will be in what the data show. So I remain optimistic that a vaccine will be found, and will be found, I hope, in the next few years. And that in order for those vaccines to really have their benefit for us, we have to be part and parcel of those research studies.